Hi guys, Leon here from PhysioZone.com, and in this video I'm going to briefly discuss radial pulse wave therapy, or shockwave therapy as it's also known. We're going to go through some of the benefits, also the applications that we use the shockwave therapy for. I'm going to show you a bit of the machine, the different components to it, and then also show you an application of a calf muscle treatment and also a little bit of the Achilles tendon. Now, a lot of times when people hear the word shockwave therapy, they actually think it's an electrical shock being applied to them, which isn't the case. It's actually a sound wave shockwave, and it's very similar to ultrasound therapy treatment, although it's a little bit more aggressive than ultrasound, and you actually can hear and feel the shock waves as it actually penetrates into the skin or into the muscle. So as I said, it's actually a non-invasive treatment, so it's not as aggressive as, let's say, dry needling or acupuncture therapy, but it has a long-term benefit, and it's a lot less aggressive and a lot less painful than, let's say, acupuncture or dry needling. So what I typically use it for is sort of long-term or chronic problems such as Achilles tendonitis or patellar tendonitis, where the traditional physiotherapy hasn't really been that successful in treating. So I find it great for those type of problems. So as I said, it's non-invasive, so it helps with long-term or chronic type of problems. It actually enhances the healing process. So what it basically does is it helps the nutrients feed into the structure or the tendon. So usually tendons are very slow in healing, so what happens with the sound wave, it actually helps to increase what we call the cell membrane permeability. So it allows the oxygen and the nutrients actually to enter into the cell a lot easier, and that then obviously helps speed up the healing process. So it also helps break down old and damaged and weakened cells, and it helps to remove some of those excess cells and waste products, as they call it, and replace it then with healthy and viable cells. So neurologically, the shockwave actually produces a decreased pain signal, and that then helps to close what they call the theoretical pain gate. So it helps with a bit of pain gating modulation. There also, in terms of the cell itself, there's also a change in terms of the vascular, the oxygenation of it, so increased blood circulation, and then obviously also oxygen feeding into the cell as well. So it also helps a little bit with reducing the carbon dioxide concentration in the tissue, and then that also helps then stimulate the healing process itself. So it helps to not only increase cell permeability and also increase nutrients to it, but then it also helps to control the muscle tone and spasm that's actually in the tissue itself. So as I mentioned briefly, there are a few applications that I would actually use it for. It's very good at deactivating what we call trigger points or local areas of muscle spasm, and that could range anything from a calf, low back, hips, glutes, or even I find it very good for upper neck tension, people with tension, headaches, that sort of stuff. So I find that really beneficial for that. You also have different applications, so sometimes you might have a pulse vibration massage applicator that you can also use for more sort of low-key massage. It's very good for stuff like plantar fasciitis. I see a lot of people who've done all the chronic treatments like acupuncture and deep tissue massage, and they've had orthotics fitted, and we've actually then been able to help them with the shockwave therapy, especially when they've had the plantar fascia or the heel pain for a very, very long time, and traditional physiotherapy hasn't worked for them. It's also good for stuff like frozen shoulder, specific calcification in the supraspinatus muscle area, rotator cuff related problems. So I find great benefits in that. Also stuff like tennis elbow, so sort of pain on the outside of the elbow, and then golfer's elbow on the inside of the elbow. It's very beneficial for that as well. A few other things like patellar tendonitis or Achilles tendonitis. I've seen a good few young kids in with a condition called Osgood-Schlatter's, where they sort of tend to grow quickly. They go through a few growth spurts, and they tend to have either pain around the tip of the knee or down towards the ankle, around the heel, where all those tendons where they start attaching onto the bony prominences. And then obviously the chronic IT band friction syndromes, The trochanteric per site is loads of runners. They would come in, they would tend to sort of get like a lot of chronic friction type of syndromes, and the shockwave therapy helps for that as well. As I said, once again, just trying to help speed up the healing process of the tendon itself. So looking at the shockwave therapy machine itself, so it's quite a large unit. It has a few different components to it. So it has the main interface unit here. So it has like a nice little touchscreen, and the brand that I have is the Chattanooga. So it has the main unit here, it has the compressor at the bottom, and then it also has the handheld device. So the hand device is a few components, and I'm going to get into that in a short bit as well. But quickly just going through that. So it has the hand unit, the guide tube, and then the applicator head, as well as the on-off switch, and I'll explain that in more detail shortly. So looking at the applicator head itself, as I said, it has the three different portions to it: the guide tube, the actually on and off switch, and then the applicator head. So I'm just going to break these down quickly so I can show you the different portions to it. Now, as you can see here as well, as I said, I've got three different types of heads, and it has the little metal end plate there. So this one here is actually the D20 unit, and what it does, so you can see just the size, the diameter of the metal end plate here. So when the bullet fires, it actually hits this metal plate here, and it spreads the sound wave, it spreads it through this, then into the application gel that we actually apply directly onto the skin, and this then transfers the sound wave through the end plate into the gel, and then through into the skin or the tendon or the muscle that we're actually applying the shockwave therapy to. So this one, as I said, is more applicable for sort of larger areas, muscular type of application, sometimes big enough tendons. If there's, if it's quite a large person, I'll actually use this on a tendon instead of one of the smaller heads. So looking at a different head here. So this is the R15 head. Very usually I'd use this more on tendons itself, or sometimes smaller muscles like the bicep tendon head, or sometimes one of the rotator cuff muscles that are very tricky to get to. Obviously I won't be able to use a massive head like this, so I tend to sort of stick to a smaller applicator head and then apply that. So the same principle applies to this. You basically screw that onto the end plate, and then you're able to sort of apply the shockwave through that, and that will once again transfer the shockwave via the bullet onto the end plate and then through into the tissue that you're busy treating. So this is the R15. So once again, a little bit smaller in terms of the spread of the sound wave, a little bit more focused. But then we have what is called the D15 unit. So you can see this is a lot, once again, a smaller applicator head than, let's say, the D20, but it has a different type of metal plate to it. So I think this is more a copper versus a stainless steel. And the same thing there, it just focuses the beam a lot deeper. So I would actually use this on very hard to reach places like piriformis, or sometimes very deep lower back muscles where you can't actually get into with the D20. So I'd use this for more of a trigger point release therapy as opposed to more superficial stuff. So same thing there, that just slides on and you just twist it on, and then that's ready to actually apply the shockwave therapy. So those are the few different heads and what I use them for. So you can see each head then just looks slightly different on the inside. So that's the end plate where the bullet actually fires onto, and I'm going to show you the bullet in just a minute. So then it just has these little seals and cushions, just once again just to help modulate the amount of force that goes into that, but I'll explain that on the main unit itself. So when we break down this even further, so this obviously also does take a little bit of maintenance once in a while. So as with any sort of metal type of object or metal type of components, there's a lot of maintenance involved in terms of cleaning and making sure that there's no residue or any moisture that gets built up or anything like that. So once again, there's a guide tube in here, and what happens then is the bullet's actually fired through that tube, as you can see there. So like every day I just clean these out, make sure that they're ready for the next treatment session. So if you can look down there, not sure if the camera is focusing enough on that. Try to focus on a little bit. So if I just dump that out, so it's a nice little magnetized bullet. And then once again that just sort of slips into the guide tube. It's like nice and magnetized. Just flip that over. Make sure that's nice and secure, and then we'll just screw on the applicator head again. Like that, and that's ready then for treatment. So looking at the main unit itself, I have the Chattanooga brand of shockwave therapy machine. So I'm just going to switch it on, and it takes a couple of seconds just for the unit to boot up, and it just runs through a couple of safety checks there as well. So looking at the programming itself, there are quite a few different protocols that you can use. Obviously with experience you know what sort of application you need to put on certain amount of shocks or certain intensities. Obviously the patient itself will also guide you. If it's someone who's who's never had any form of shockwave therapy before, obviously I'd go on what the patient is able to tolerate, as opposed to strictly going to set out guidelines. So I'd have to sort of play around a bit in terms of intensities and just, you know, be sure that the patient is comfortable with tolerating the amount of impulses or the intensity that I actually apply the shockwave to. So a couple of settings that we do change. So also depending on the type of tissue that I'm busy treating, that will require a certain amount of shocks or a certain amount of frequencies. So I'm just going to run through some of the basic settings that I have on here as well. Looking at the home screen display of the unit, on your left, and as I said, this is all touchscreen. On the left we have a few different buttons that you can select, quick click indications, clinical protocols, depending on what type of structure or what type of muscle that you're busy treating. You can use preset clinical protocols, some user saved protocols, some that I would use. If I use them quite frequently, I would just literally just save a couple of them and have a quick go-to link instead of having to set up the machine manually the whole time. Also, it has two channels if you have two applicator heads. So sometimes you might use the traditional shockwave therapy unit, or you might have what they call a V applicator, which is more for massage type of treatments, which I don't have. So I tend to use just the one channel itself. So then it also has the ramp on and off. So ramp just meaning that it's gonna start off at a lower intensity and gradually build up the intensity as we go. At the bottom here, also a couple of buttons. So just an emergency stop button if something happens to go wrong, or if the patient doesn't really tolerate the treatment that much, I can just quickly stop it or pause it. And then obviously just start the treatment process as well. A couple of function buttons in here, just in terms of setting up clinic protocols, etc. So at the top here, that's the current setting. The amount of impulses that we're going to put in is 2000 currently at the frequency rate of 10, and then that's the applicator head itself, and then obviously the intensity bar here, which you can adjust up and down. So I'm going to show a typical example for a calf setup. So what I would tend to do is, I actually, just purely because of experience that I've had with it, I would actually just quickly set it up myself. So at the moment, the mode is continuous. The ramp I'm going to actually set to on. And then for this applicator, the transmitter head, we're going to use the D20 in any way. So if we're going to start treating something like a calf muscle, so obviously it's relatively big in terms of size-wise. So we want to, if we're going to try and apply only a smaller number of shocks into the muscle itself, it's not necessarily going to be that effective. So we tend to increase, depending on the size of the muscle, we tend to increase not only the intensity or the frequency, but we intend the amount of pulses going into that muscle itself. So if I have to cover a larger area, obviously I'd need to apply a lot more shocks. So for the calf as well, I usually go between 2,500 to 3,000, depending on how big the muscle is itself. and then also how much layer of tissue I need to go through. So if it's quite a bulky calf, obviously we need to apply a lot more pulses into it to be effective. So same with energy. Now usually I would start off, if it's the first session of Shockwave the client would get, I'd start off at a relatively low intensity. So a 2 bar for now should be okay. And then the frequency. So obviously the frequency, the lower the frequency is, the shorter, the longer the amount of tapping in between the firing of the bullet is going to be. So if I increase this, I tend to stick to between 10 to 15 hertz. And if it's more muscular, the higher frequencies are actually more tolerable than the lower frequencies. So if it's more tendon, I'd obviously go slightly lower than that, and I tend to stick to sort of 10 hertz or something like that. So I'm pretty happy with the setting as it is at the moment. So I'm just going to go back and we're ready to go. So you can see it saved all the settings at the moment, and I'm just going to show you how that's actually applied. Okay, so I have all the settings ready on the machine, and I'm going to apply the Shockwave therapy onto the client. So before I actually do that, while I'm busy setting him up and getting them ready for the treatment itself, all I'll do is I'll switch on the machine so they can basically hear what it's going to sound like, so they don't get that initial fright, as it can be a little bit daunting when you actually hear it. So I'm going to switch this on just so you can hear what it sounds like. So the compressor is basically buzzing away there at the moment, and it's busy building up the pressure. So as you can imagine, it is quite frightening and it's quite loud when you hear that. So while that's busy getting ready, all I do is I'd explain to the client what's going to happen, what they're going to feel like, and what it actually sounds like. So before I actually apply the applicator directly onto the skin, I actually switch it on first. So once again, pretty loud, and that's what they're going to hear when I'm actually applying it to them. All right, so I'm ready to give all the treatment onto the calf itself. So before I start off with that, I'm just going to apply a little bit of gel onto the calf muscle, and then straight after that we're going to do a bit of treatment onto the Achilles tendon. So I'm just going to use regular ultrasound gel and just give that a good bit, especially the more hairy the person is, the more ultrasound gel you need to apply for the Shockwave to actually penetrate into the skin. So I have the machine all set up and ready to go. I'm just going to spit out the gel before I begin. So the machine is all set. Going to get that going. So once again, as I said, I'll just sort of get the machine ready, start it off, let it have a few beats there just so that the client can get used to what it sounds like. And then I'll actually switch it on before I actually apply it directly onto the skin. All right, so here we go. So as you can hear, it's pretty loud. And all we want to do is we just want to keep moving the applicator head through the structure that's actually being treated. And seeing that it's a pretty big calf, there's a lot of surface area that we need to cover. So at the moment the bullet's actually firing through the tube, sitting into the end plate, and then it sort of spreads the sound wave through the gel and then into the muscle itself. Now the client might experience a few different things. On certain of the trigger points, I would actually be able to see some of the twitching in the muscle as it actually hits onto the trigger point, or the client might also say, well, that's a very sensitive area. So just obviously be cautious that you're not applying too high an intensity on the first session. And necessarily, depending on the tolerance of the client, then you'll have to just increase or decrease the intensity of the Shockwave itself. So going a little bit into the Achilles tendon here at the moment, and then into the muscle belly itself. And then in between, you'd also ask the client, so how's he feeling? Is he able to tolerate that? Do you need to set it up higher or lower, depending on how much they can tolerate? So almost there, a few more to go. and that's the application of the shockwave into the calf muscle itself. Now if I had to zoom in a small bit, you definitely also see how red that area is just with the amount of blood and oxygen being put into that. Okay, so I've changed the settings on the machine and I'm going to apply the shockwave directly onto the Achilles tendon. So I've changed my applicator head onto the R15, which is once again a smaller diameter for the shockwave to be applied. And it's a little bit more handier, especially when you're dealing with a tricky section like a tendon. So it's a lot more easier to apply the shockwave and sort of tilt the head of the applicator just so you can cover more area of the shockwave onto the tendon itself. Whereas with a bigger head, it would be a lot bulkier and a lot more tricky to get into those hard to reach places. So same thing there, I've set up the machine. I'm going to start doing a bit of treatment onto the Achilles tendon. Now with the tendon portion, it's usually a little bit more tender, especially when you get onto the attachment points or where the tendon sort of starts going over into the bony section. So you just let the patient know this is going to be a little bit tender, especially when you get down onto the heel. But in the tendon portion itself, that shouldn't be too bad. So I've got the gel all nicely spread out, so I'm just going to start the machine and we're going to do the same treatment again. So once again, before I actually apply the applicator directly onto the skin, I'll actually start it off so that they get used to the sensation of it first, know what to expect, put a little stretch onto the Achilles tendon and then actually start applying it there. So once again, depending on the tolerance of the client, you just let them know if they need to either turn the applicator up or down. Just let them know as soon as you start getting over onto the tender bits of the tendon itself. So the importance of actually moving the applicator head is to prevent what we call cavitation. So you don't want to apply the shockwave on one particular area for too long a period of time. So if I actually had to leave the applicator head in one position for a very long time, that can actually cause a slight bit of damage, which we don't want. So a little bit of damage is fine because we want to try to stimulate that natural healing process to happen, but we don't want to be detrimental towards the tissue itself. So hence that's why we keep moving the application. Now if it was a client who's got chronic Achilles tendinopathy, some people get more towards the insertion point of it, some people will get higher up, some people will get directly into the Achilles tendon itself. So if you go over a section where it's very painful, the client will actually say that, oh, this is the most sensitive area for them. So then you'll know you'll spend a little bit more time just on the areas where it's a little bit more tender. And the same thing there, I'll sort of angle the application, just try and hit those sensitive areas on different areas. Just vary it up a small bit so you're not applying it in the same plane the whole time. And then once again, just taking note of patient compliance. If it gets too sore, you'd rather just turn down the intensity but keep going with the treatment. So once again, a few more seconds to go. So as I was saying, usually with an Achilles tendonitis, I would tend to have between 2,000 to 2,500 shockwaves going into the tendon. Once again, depending on the size of the tendon and the area that we need to actually apply it to. But for this treatment session, the 2,500 shockwaves is sufficient. Well guys, there you have it. Short description and video of shockwave therapy and what it's about, the different types of applications as well as the benefit for it. And if you want more information of the scientific background with regard to shockwave therapy, you can also visit my website physiozone.com/shockwave to get more information. So thanks again for watching and hope to see you again soon.
Follow us on Facebook, Twitter, and YouTube.